Ra-pa-pa-ra-ta-ta. I think we are live. Just a minute. Let me confirm. Mm, 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 mm. Yes, we're live. So, good afternoon, everybody. Welcome to another episode. And today we'll be talking to Dr. Akinsanmi, who is a dentist and also health informatician. Thank you, Dr. Somi, for making our time to come and talk to us about your journey studying health informatics and all of that. So I think I'll just pass on the mic to you to introduce yourself. Let us meet you.
Okay. Good afternoon, everyone. My name is Dr. Akinsanmi Apara. I'm a dentist by profession, graduated in 2011. Did a lot of clinical practice within that time till 2021 before moving to the UK to study my master's in health informatics. So,
Okay.
yeah, briefly, that's my journey in a nutshell.
Okay, that's interesting. So prior to going for your postgraduate degree, I'll assume that you were working as a dentist, or was there any other thing you were doing?
Okay, so my journey was quite interesting. I started off as a clinician. That was during my post NYSC. I worked as a dentist slash
Okay.
practice manager in a small clinic in my little town in Oshobo for 2014 to 2015. It was quite an interesting time because it was still an up and coming clinic. So I was the dentist, I was the marketer, I was the practice manager. I was going around to schools, going around to businesses to give talk on oral health, try to sensitize the public on how on oral health and why they need to take care of their teeth. So 2015, I moved down to Lagos because I believe that I served my time in Oshogo for a while, and I moved to Lagos to work in a private dental clinic where I worked from 2015 all the way till 2021. There, I started off as an associate dentist. With time, I moved also again to become a quality assurance manager, part-time practice manager, part-time HR. It was really an interesting time because I got to see more of the non-clinical side of dentistry. I delved more into that. I was able to see how the admin side of dentistry worked, what it entailed to work as a non-clinical dentist. In 2019 slash 2020, the clinic I worked for, Smile 360, shout out to Smile 360, opened up a clinic in Abuja. And then I was sent to the clinic in Abuja to help them open up and spearhead. Then I went there, and beyond just being a clinical dentist, I also did a lot of work as a non-clinical dentist again. And this time, my scope went just beyond the admin. I went into a lot of construction too because it was a new clinic, so I had to deal with vendors, I had to deal with contractors. It was really fun because you tend to learn how dentistry is built. A dental clinic is built. You learn
Yeah.
how you need to set up a clinic. You need how to collaborate with other vendors, other contractors to make your clinic a success, how to market your clinic,
Clinic.
because a lot of the time people have the notion that clinics or hospitals are purely humanitarian, but then we have to also look at hospitals and clinic as a business, because if they cannot survive, then they cannot perform their humanitarian duties. Also, while I was at Smart 360, I also was a project manager for the for one of their non their own CSR, which was Project Smile, whereby we tried to recreate the beauty of a smile for a lot of people that were really needing it at the time. We had people that required major smile reconstructions that we actually do for. We had a lot of success stories, and it was really fun. Then come 2021 September, all this time, I've always been interested in the evolution of dentistry, especially digital. And I know I keep going back to Smart 360, but they gave me a platform to actually explore that aspect of dentistry, because they were very keen on always bringing in some digital evolution into dentistry. So it gave me time to actually study with a lot of things that were going on in terms of the digital aspect of dentistry, digital smile, digital crowns, digital impressions. And that really got me interested in what I can do to actually help build dentistry.
Yeah.
We had some electronic medical records that we were using in my clinic, but I found out that they were not. To be fair, they were good. They were very good, but in a way, they were not fit for purpose, in the sense that they were not designed for the African
Yeah.
African scope, the African scene. They were designed more for Western. So I was always interested in seeing what I could do to actually create or build something that was more local, that was more homegrown, something
Yeah.
that was fit for the African scene. And that's what really got me interested in digital dentistry. At the time, I applied for digital dentistry and health informatics, but along the way, doing further research, I found out that health informatics was leaning more towards what I was thinking or what I was planning in terms of moving dentistry forward. So, luckily enough, I was able to get the master's program for health informatics in Swansea University. And I started in 21 September, and just graduated 2 months ago. And that's been my
Congratulations.
journey so far.
Okay, that's interesting. So looking at health informatics now, I mean, were there other courses you were considering, maybe like digital health, MSc, artificial intelligence, and all of that? Why did you settle, for health informatics?
So, um, when I was considering this, I thought about digital dentistry. I thought about health informatics. I thought about data analysis, health data analysis.
Okay.
I there was an wait, there was another one I thought about. No, well, basically those three were the main things that were more relating to what I was thinking about when my mind comes to digital dentistry.
Yeah.
Um, but I found out that health informatics kind of encompasses all of them in a way. It was broader. It covered it in a more broad fashion, because it health informatics basically is a combination of healthcare
Yeah.
information and digital information technology, and some form of digital aspects in dentistry. So and then I looked at what you can even do as subspecialists in health informatics. I found out that under health informatics, you could be a change analyst, you could be a quality information quality controller. You could you could delve into machine learning. You could even delve into some aspects of artificial intelligence. So that actually piqued my interest. And then I decided to take up health informatics as compared to digital dentistry or digital health, sorry, or
Yeah.
um, health health data analysis.
Okay. That's interesting. If you guys are watching, if you have any questions, please pop it in the chat, comment section rather. I'll see it here and we'll take it from there. So talking about your studying health informatics, I mean, I get this question from a lot of dentists, you know. So some people are wondering, what's the experience like? Is it difficult? Is it challenging? Is it easy? I mean, what's your experience? I mean, I think that might, you know, I said I can't answer from a dentist perspective. So you will be the best person to answer that question.
Well, I will start by saying it's an uncharted territory for me. My personal experience, it was an uncharted territory for me. However, because of the digital background I had from where I trained, it wasn't so complicated. I had an idea. So it was more or less health informatics it's not dealing with a specific part of healthcare. So it was broad. You personally would be the one to tailor it towards your profession in the end. Yeah, when I came in, I most of the courses we were doing discussed on healthcare in general, but I had to tailor it towards dentistry. We had courses in medical coding, we had courses in change management, we had courses in privacy and confidentiality and all of that. And at the time, it seemed like it was tailored to medicine as a whole. But we also have to remember that dentistry is actually an aspect in medicine, is a part of medicine. So you just have to tailor whatever the information you get to fit into the dentist perspective. And it actually works perfectly. Whatever health information, because we have just the same way we have electronic medical records in medicine, we also have electronic medical records in dentistry. So it's the same information, it's just how it's used that is different, and you need to tailor it towards your profession.
Yeah.
The course as a whole was so I would like to say it was not difficult, but it was challenging. I would because in the end, it's if you've always been in, especially if you've always been in the clinical aspect of medicine, it
Yeah.
would look a bit strange to you if you've never had to deal with anything had admin like looking at the background of the medical records or have to deal with implementing a project, implementing change, or having to deal with um, patients' records or patient privacy and confidentiality. A lot of the things that will be said will sound a bit strange to you. So it's now left to you to try to read more and study more. The MSc we did it was more along the line of research rather than physical work, which I think a lot of people need to actually have that information before going in, because sometimes when you hear the word health informatics and you see the things that they deal with, you hear machine learning, you hear artificial intelligence, you hear medical coding. A lot of the time, the thing that goes back of your mind is, do I need to know how to code? Do I need to know anything about artificial intelligence? So it comes with some level of fear and excitement. Then you get into the course and you find out it's a whole different ball game, and you find you are doing more of researching, you are doing more of checking the literature, of referencing, of actually reading and delving deep into a lot of these informations that you've heard about. So, like I said, it's not difficult, but it might pose a little bit of a challenge, especially if you don't have any level of non-clinical experience in the dentistry profession.
Okay, so I mean, looking back in hindsight now, are there things that you think that maybe if you had known more, would probably have made it easier or less challenging?
So, first off, I wish I had known that it was going to be more of research than actual the physical work. Because in my mind, I thought, oh, this course is going to teach me how to code. I'm going to learn how to do some coding. So before coming in for the course, I decided to, take the bull by the horn and I did some training in HTML, CSS. I even started off a little bit on JavaScript, came into try to start a little bit on Python, just to get like a broad sense of the thing that would be learning when I enter into the course. Then I come into the course and I find out that it's just basically research, and I'm like, oh, okay. So I wish I'd known that. Maybe I would have learned to practice more on my research skills rather than
Okay.
and then maybe I would have learned to also practice more on data analysis. Maybe those were the ones that were more they were more useful to the
Yeah.
course than the whole Python. Don't get me wrong, learning coding it's one of the greatest favors you could do to yourself, because with the way the world is going, coding might be the next digital language that everybody will have to know how to speak before you can actually communicate. So, yeah, learn a form of coding, it's perfect. But if you are going to be doing health informatics, I would advise that you actually do more research into the course in itself that you are going to be doing it and the university in which you will be doing the course in, because different universities apply different approach
Yeah. Okay.
to how they teach the health informatics. Health informatics in some universities in America would actually require you to know a form of coding, a coding language.
Mm-hmm.
But like the one we did in Swansea was not having a background in coding was not like a mandatory criteria.
Yeah.
It was a booster for you, but it was not a mandatory criteria. And you tend to learn more that health information technology goes just beyond coding and designing code, and there are other aspects. There's, like I mentioned, change implementation, knowledge management, and a host of other things you can do as a non-coder learning health informatics. And it's even more beautiful in dentistry because it's still, like I said, uncharted territory in dentistry. So you can be a pioneer in some of these non-coding aspects of health information technology.
Okay. That sounds good. So somebody just popped in a question here. Let me before we continue. He said, "How much do I guess this is health informaticians earn?"
So health informaticians actually, it's like I said, it's based on the country and the part of health information that you are in. Health informatics, the line in health informatics that you are following, your your career progression. Some, because you can say medical coders are also some form of health informatician,
Yeah, definitely.
and I'm not sure that any medical coder can come and say that the salary is is as beautiful as you hope it would be.
In fact, one of these days, I'm bringing a medical coder to come and talk. So
Yeah,
that's fine.
because I personally believe the work that goes into medical coding does not does not tally with the amount that they are given, because medical coding requires a lot of work,
Yeah,
and the pay doesn't seem to really match up. And I'm sure they would probably fight for better pay at some point. But
yeah,
like I said, it's the line you're towing in health informatics also will determine the kind of salary you earn. Some people earn as high as £100,000 per annum, some as high as £70,000 per annum, while some go as low as £18,000 per annum. It's basically just follows the line that you are following in in health informatics. And if you are a pathfinder, like some people, and
yeah,
you find your niche where you can actually develop yourself and become a need for the general public, you will find that you can actually go you can fall in the higher level of earners. Say, for example, if you just think about that, like I was talking about health information record, how about I become one of the people that design a pure dental health information record system that suits the country that I come from?
yeah,
That automatically creates a need, because I know I've worked within my system, so I know what will work for my system. And if I design something along that line, I would most likely get more people interested in buying my products,
mm-hmm,
because I will work not just with the diseases that are more common to us or the nomenclatures that we are used to. I also work with the amounts that I know would benefit more for the procedures that they do. And we can now tally that to how our own system works, and it would work much better and it, than, say, for example, a Western health medical record that works on a broad sense. And then because I come from the country and I work with the country, I'll be more I'll be more at hand to give a better system support, customer support. So I'll be more valuable, and that will create a niche for me, and that would also increase what I can earn,
and
because
yeah,
I've created a system based on the needs of my target population.
yeah. I think that sounds cool. Sixes, I don't know if you're still watching, so I guess that also sort of answers your question. So basically, I mean, how much you earn depends on, I mean, the career path you're looking to, take. Because I mean, health informatics gives you like a wide open playing field. There are so many things you can do. Like you said, you could be a change expert, you could be an implementation expert, you can decide to go into information governance, you can go into risk assessment, you can go into quality improvement, you can go into research, UX research. I mean, the boundaries are limitless. So, and all these professions have different amounts they pay. So it depends on what you're looking out for, really. So there's another question here. I'll just bring it here. So Lat B says, how do you intend to use this course in dentistry as a professional or career? Or if you can give different careers this can be used for in dentistry. I guess this is a dentist asking. So maybe it's your colleague.
Well, so like I said, when the course was taught to us, it was taught in a broader fashion. But like I mentioned, we have to find a way to tailor it towards dentistry as a profession. This course teaches us health information technology. One of the things that it will delve on, and one of the projects I actually did during my course was to design a teledentistry application, software application,
Okay.
which allowed me to be able to create a community for both dentists and patients to be able to discuss with each other and find. And then we had some videos that would talk about what you can do in an emergency situation. So that teledentistry is a part of health information technology. So that is something you can use health informatics to do. We also talked about, like I talked about, also the health medical records. That's also a part of health information technology, which is health informatics, and that is something you can actually use to design a more tailored dentistry health electronic medical record that would suit purpose for your dental clinic. You can also use this course to be a change or implementation officer in terms of selling health information records to dental clinics and help the staff of the dental clinics to actually accept change. One of the hardest things you can ever do, which both from my experience and from teaching, is to get a group of staff to accept any form of change. It is one of the hardest things. One of the things you learn in the course is that you have to group you have to group the people into their learning curve, which is you have the you have the slow learners, you have the fast learners, and you have the middle learners. You have the slow adopters, you have the middle adopters, you have the late adopters. Another thing we were able to learn in this course is the fact that most people tend to qualify and say, oh, all dentists will probably fall under the category of early adopters, or maybe all nurses will fall under the category of middle adopters, all this particular set of people will fall under the category of late adopters, which we find out that it's not really the case, because sometimes you would have dentists who fall under the category of late adopters, not because they don't know how it works, but because other external factors
Yeah.
might prevent them from learning it early. Say, for example, if it's a dentist that is always working, he probably doesn't have the time to sit down and start learning the new application system. So he's going to fall under the category of late adopters, not because he doesn't know it, but because he just doesn't have the time. We
Yeah.
have dentists that are used to a particular system, and telling them to switch to a different system will pose a challenge for them because they already know how well the system works for them. They have no concern with the system. Maybe
Mm-hmm.
one of two things are new in this new system that might benefit them, but they are not used to that and they are not ready to change so easily. They will fall under the either middle or late adopters. So, like I say, you have to. This is also it's actually a career in health informatics, being a change executive, helping clinics accept, or how you can face the change, how you can put the change for them in phases so that implementation will be easier for clinics, which was something I wish we had when I was working in the practice when we were going to change from an old system to a new
A
system.
new one.
So if we had that, I'm sure the transition might have been much easier for us. But I mean, this course has been able to open my eyes to the fact that it's actually a whole profession
On its
that
own.
actually
Yeah.
does that. We have a lot of information in dentistry that are not being tapped into right now because nobody has ever thought about it. And it's actually a career progression on people analyzing dental data to provide information for change implementation, for government bodies, for policymakers, because this information is quite important and it can actually help them fashion a way to move dentistry forward. So this health informatics, like I mentioned, you just have to tailor it towards how you can use it to better yourself in dentistry. But I can say that there are a lot of career progressions in dentistry used in health informatics along the dentistry profession.
All right, thanks for that, Somi. Lat B, if you're still watching, I hope he's been able to shed light on how health informatics applies to dentistry and the different job roles or opportunities available for a dentist who is looking to study health informatics. I think I'll probably do a video one of these days to talk about different career options available for dentists who study health informatics. I've made a note of that, so I will do that. Then there's another question here. I'll bring it up in a second. So this is from Joseph Kende Akingba. So I hope I got that right. So he's saying, what advice will you give to a newly graduated dentist who wants to explore health informatics and the steps to follow?
Okay, so this might be a personal opinion,
Yeah.
or probably I would say old school opinion, because I'm old school. But I would advise that you first actually have some experience in the clinical part of your course. It's, I mean, it's possible to finish school, graduate, and jump straight into health informatics. But then once you come into health informatics without a proper background of the dentistry that you studied, there's a chance that you might come out of the health informatics with a more broader knowledge of something else, and you might not actually pursue the dentistry, the dental aspect of health informatics. You would most likely want to think of other common, quote unquote, more common aspects in health
Yeah.
informatics. So if you are thinking about doing health informatics in a dental perspective, then it is advisable you actually practice dentistry first for a while. For a while could be as low as 2 years. For me, I actually had practiced dentistry for 10 years before actually moving. So it's not, you can, it varies, but I would advise that if you want to practice health informatics within the dentistry profession, then you might want to actually gain some experience in the dentistry profession first. However, if you are looking to more general or a more broad sense of health informatics, then by all means, you can start as soon as you are ready. All you just need to do is first off, find a school that offers the course. Once you find the school that offers the course, they will tell you their requirements, follow their requirements, get your admission, pay your school fees, get your visa, and move to the country and start your course.
See the way I'm saying it as if it's so easy.
Well, the truth is, it's best, it's best. Would I say it's best? But it's the truth is, it's not as challenging if you follow the process as it's stated for you. If they
Yeah.
say for this course you need so A, B, C, D, E, and you follow A, B, C, D, E, there's a high chance that you will get the course. I did a lot of try and failure. I did a lot of try and fail because I'd applied to some different schools in another country, did not get the visa, did not get this. So I come with some level of knowledge of knowing that if you don't follow as they ask, chances are that you might not get what you are looking for. It's also advisable if you can get yourself an experienced licensed agent. Again, I'll say it, experienced licensed agent. because there are a lot of agents out there that are ready to help you, but some of them don't have the experience required for the course you want to go for. So again, from experience, I learned that the hard way, knowing that they might have the experience to get you somewhere else, but they might not have the experience for where you are going to. And they try to use the old experience of the ones they know to help you, and then you fall into various pitfalls, and then
Mm-hmm.
you waste a lot of money.
Yeah.
So if you want to use an agent, make sure that it's a tried and tested agent that actually knows about the course you are going for and how best to help you get into it.
Yeah. I think I quite agree with you. I think the part where you said he needs to get some work experience. I mean, it makes a lot of sense to, understand the industry where you're working in. Work for as a dentist 1 2 years, then you understand how it works, so that, I mean, coming with your informatics knowledge now, it makes more sense, and you're better, suited to apply maybe whatever change you want to implement or all of that, rather than just jumping into, from, undergrad into postgrad immediately and all of that. It's not that saying it's not good or it's impossible, but I mean, from personal experience, I think it makes more sense, and
Mhm.
the course now makes more meaning or sense to you when you're actually studying it. So that's what I think. Then there, yeah, I think I have a video I did a couple of days ago on how to get into health informatics in the UK. If you're looking at UK as your where you want to school, there's a video I did a couple of days ago. I think I tried to talk about the different schools in the UK that offer health informatics, their school fees and, requirements and all of that. So you might just want to look for it and watch it, right? So Joseph, if you're still watching, I guess, or I hope that he's been able to answer your question. Oh, okay, all right. I've seen his comment. He said thank you, so that makes a lot of sense. Then let me check here. So somebody is sending me a DM, is asking, how are you able to combine studying and and working in the UK? Or did you have all the money you needed to come to the UK or go to the
Ah,
UK?
the age-old question: how are you able to work and study in the UK?
Yeah.
Number one, I will say partly the course in itself, the way the course was structured, was a huge help for us to be able to combine work and study. Because the way the course was structured, we had 1 full week of lectures every month. The rest of the month, you are out there doing your research, doing your assignments, doing your own work, doing your analysis. So you had time to be able to do some work, which, by the way, in case you didn't know, in the UK, as a student, you're only entitled to 20 hours of work. So that in itself gives you more time to actually study because you can't do beyond 20 hours of work on your visa. So you have a lot of time to study, and whichever company you work for understands that with your student visa you can't work beyond a certain amount of hours. So they to also try to fashion your working schedule to fit into that time frame. So you do have enough time to actually do a lot of research and reading, which in health informatics you will do. You will do a lot of reading. You will do a lot of like I'm not going to sugarcoat it for you. You are going to do a lot of reading and research. You will read because you will have to reference every statement you make in your presentation, in your work. You have to reference everything. Some of them might even require you to have 2 or 3 references. And for you to be able to reference anything legally, you have to have read it to be able to reference it. No reading, no referencing. So you will have to read a lot. So the way they structure the course in itself gives you enough time to not only read but also work within the time frame that is given to you. So you will be fine. If I can do it, you can do it.
All right, thanks for that. There's another question here. Let me bring it up screen. So Sixtus is still watching. He's asking which is better, doing residency and specializing, or doing a master's in medical informatics and following that career path.
Now that question is a very loaded question.
Yeah.
Again, it comes down to your personal belief or whatever. Some people do it any way you go is the right way. In short, any way you go is the right way. If you go for residency and you specialize, that is one of the best things you can do. If you choose to go for your master's in health medical informatics and follow that career path, also that's a good thing you can do. Just know that this is what you want to do and then do it. Some people, no, honestly, nobody can actually say this is the right one to do. None of them is better. They are both very good. Whichever road you follow is the good. Some people don't do residency, they don't do masters, and they are following their own personal career path and they are doing excellent. So you can't,
Yeah.
there's no better way. There's just the way you want to go. That's the way you should go. So there's no, I can't say there's anyone that is better. They are both really good, whichever way you choose to go.
But I think I also, chip in here. I mean, like you said, it's a personal decision. I've seen doctors who do residency after specializing, they still go ahead to do an MSc in health informatics or whatever. I've seen those who said, like, we are not doing residency. Let's just do this first degree, work a little bit, and go and do the MSc and continue from there. So it all boils down to what is your own personal, conviction or decision. Some people get into an MSc because of different reasons. For example, some people are like, okay, I don't want to do call again. I don't want anybody to be calling me at odd hours and all of that. So I just want to do a regular 9 to 5 and go and rest. Some people, they are burnt out from working in clinics. I mean, we're talking of burnout, clinician burnout now. I mean, you're seeing 100 patients a day. You don't even have time to rest. People are doing dirty December. You are in the hospital, cleaning teeth or doing one thing or the other. Some people are just looking for that good work-life balance, and this is one of the pathways that could offer them that, because they just do a traditional 9 to 5 and they rest during their weekend. They can go for vacations and all of that. That's still fine. Some people would want to, have a role to play in digital innovation, or seeing how they can, have a role to play in health tech, using technology to support healthcare. That's still fine. So it all depends on what you want to do, and your own, I mean, so it's not something somebody will decide for you. It's left for you to, do your own research, ask yourself the hard questions. Is this what I really want to do? Because sometimes, again, I mean, heading into areas like this, like you said, initially is uncharted. So it's like you don't have a lot of people who have done this. So what's the evidence that this is the correct decision?
Mhm.
Because we are seeing, okay, we are seeing specialists, we are seeing dental specialists, they are doing well and all of that. But you've not seen a dentist who has done health informatics and probably doing well and all of that. So where is the conviction to say, okay, let me follow this pathway here? So, but you have to be convinced yourself that this is the correct way to go. And last, somebody used to tell me, if it doesn't work out, you fall back to the clinic.
You always have your certificates. You
You
have
still
your
have your
dental professional
certificate.
certificate. So you can always go back and do your clinical.
Yeah, you go back to the clinics and continue practicing until something else, pops up and all of that. So, Sictus, I don't know if you're still watching. So that, I think that's what we think. It's for you to decide on what you want to do really, and just follow it through. And I think that's also one of the reasons why I try to do this, bringing people um who are in these different areas to come and share their experience. So it helps people, make better informed decision. I mean, like now we're seeing a dentist who has decided to go for health informatics. Okay, you'll be like say, okay, road they decide, make we they follow them, they go.
No, Abina. We'll find road. We will find road anywhere.
So yeah, he's saying thank you so much that he asked because is currently a final year medical student and is just confused. Don't be confused though. Just take it one day at a time.
I think your first priority is to pass the final MB, pass the exam
Yes.
first. Then you can come and sit down and now think about the road, because graduate. The first thing you need to do is first graduate, finish school, graduate. There's time. Don't worry. There's time for you to make the decisions that you want to make. Who knows? In the next 2-3 years, there might be a another course that would even suit you better than medical or health
Health
informatics that you might
informatics,
find.
right? Yeah.
Or there might even be we might have created a new sub residency in dentistry that you will find interesting. So give first thing, pass your exam,
Yeah.
graduate, collect your certificate, collect your license. Then the road would always show itself to you, because the more you practice, the more you know what you want to do. So yeah, you have time. Don't worry.
So 6 to share you've heard. So first things first, let's get your license sorted out before you head into other waters. I mean, the sky is broad, the options are numerous, so there's no need to be confused. Let me see if there is any other question from here. Just a second. Mm, mm, mm. All right, then. Okay, I don't think there's any other question for now. So, I mean, from your experience so far, so would you recommend the course? Would you recommend to dentists to come and study health informatics? Or
Well, I would definitely recommend that even if you don't study it as a master's course, you can look for probably certification courses, if there are any, just to get an information, know a little bit more about managing patient information, because with the way the world is going, litigations are going to be more. And one of the easiest paths to ever catch a clinician is patient records. That is one of the ways that any clinician can fall into any form of pitfalls.
yeah,
So, learning about patient information, its management, how to disseminate the information, what to watch out for, patient confidentiality, patient privacy, how to present patient information, how to hide some patient information, who the patient information should go to, how it should get to them. Those are some of the things that I believe would really work for you, especially if you are one of the few dentists that will plan to move out of Nigeria to try and practice in a different country. Those information will be really beneficial. As a matter of fact, it will be one of the criteria that they will ask you to know. What is the role of, say, for example, in the UK now, they will ask you what the role of GDPR is. In America, I've forgotten the America's code information body. I can't remember. Is it
I know
ECHR or
there's
something?
IPA regulations.
Yes, the IPA. So those are very vital things you would need to know. And I'm sure with the way Nigeria is going, we are going to start having some of these situations whereby patient information and records will be of utmost importance. And managing those records is something you would need to learn. So if you want to be somebody that will be able to be in the forefront of teaching or educating people on how to manage this information, health informatics is the course for you, because not only would you learn that, you would also learn how to help people manage change, how to help people design application softwares that pertain to health, how to manage the information on this. Because even with the application software, you also need to know how to manage information. Basically, the world is a whole ball. We are just a whole ball of information floating around. Managing this information is going to become one of the hot cakes in the nearest future. So if you want to get on top of that, then health informatics is going to be the course for you.
Right, guys, you've heard it too. So if you're a dentist, so it's a good option for you. Then somebody is asking here, let me see. So how easy is it to get jobs after the degree?
So here's the truth. It's not easy to get any form of job, whether it's health informatics or it's even dentistry. In the end, you have to you just have to put yourself out there, let them know what you can do, and the right set of companies will ask you to come over and work for them. I would not say it's hard, but I would not definitely not say it's easy to get any job. In
Yeah.
the Especially, like I said, it's uncharted territory. So most people would not know what to use to do with you, because it's not something they are used to. So you have to be the one to present yourself, to show them this is exactly what I can do, and this is what you will need in the coming future, because the world is moving towards a more evolved digital revolution, and you need to be at the forefront. Any company that believes in moving with the times would see you as a valuable asset. So the world is out there. You just need to let them know what you can do.
Right. Okay. Let me see if there is any other question. We're close to the 1 hour mark. I didn't expect to spend up to an hour here. Just a minute. So yeah, there are no more questions. I think we've been able to do justice to most of the burning questions that a lot of dentists have. So I'll also share this video. I think I'll still leave it on my live stream so people can still come back to watch it. I mean, I had a lot of dentists asking me some of these questions, but I'm glad we've sorted them out. So thank you so much, Somi, for coming on, and yeah, wish you the best in your endeavors.
Thank you.
All right, guys. Bye for now. Till I come your way next episode. Stay safe and fine. Bye. And broadcast.